feel better, but it's maybe a bit more philosophical than what we need to get into, but like, because something makes you feel better, should you do it? Like, what are the limits of that? Because I think that's something that people don't really think about.
Yeah, individual, balancing it for your individual needs. We're live on TikTok, by the way.
Oh, that's awesome. Okay, I'll come over here. And then I'll just start this thing, and I think it's ever since I did one show where, I think we're live on this too. I did a show where, like, none of it got recorded, so it was almost like a old movie from the 40s, and nobody was playing piano to set the mood for us, so it didn't quite work out.
Hey, Petty, welcome in. This is my friend Nick. He's
Hello.
a nurse anesthetist, and he's gonna interview me. No, we're gonna chat. I don't want to be interviewed.
know.
We're gonna have a discussion, a professional conversation about ADHD.
Yeah, I mean, usually I get too excited about these, and then I talk too much, so it'll be helpful that I try not to plan too much.
Yeah, we can pretty much follow conversations. So thanks for the likes. Share out the live with any of your neurospicy friends that might need the support. Nick, do you want to introduce yourself? Who you are, what you do?
I'm trying to remember what my TikTok handle is too. I think it's Ether Dripper. I'm a nurse anesthetist. I'm the owner of Ascend Health Center down the street. It took me a few minutes to find here, but that's because I'm not good with directions at all. So we do psychiatry, some counseling. I do ketamine infusions for anxiety, depression, things of that nature, also chronic pain. We did a 6-hour infusion today. That was really interesting. Basically somebody's orbiting the solar system for 6 hours at those rates for chronic pain. What else do we do? Transcranial magnetic stimulation, another treatment for depression. So a lot of it's just for treatment-resistant type of things. A lot of what we do is a little bit either novel or cutting-edge research, so people often don't visit us if they're like, well, I might be slightly sad, I'm not sure. It's more of like, okay, I've tried a few different things, and now let's get to fixing it.
Mm-hmm.
So,
yeah, I've tried all the things, and none of it works.
Mm-hmm.
Yeah.
But it's kind of goes into our conversation about ADHD, because you have some people who've tried electroconvulsive therapy and did nothing. And you make just one small change and boom, like they're better.
Mm-hmm.
And then other people where you're like, you're not really that bad, bro. And then it's like, oh, I tried my hardest and like they're no better. So it's just interesting how anytime we talk about mental health, it isn't some sort of like, okay, here's all the categories, you're bad or you're good. Or everyone's so unique.
It's so unique. And there's so many factors to consider and so many things to assess, but also like needing the safety with the person that's coming to see you, the client or the patient, to let them open up and actually tell you everything that's going on so you have a full picture. So I'm Amanda Costura. I'm the founder of Carve Your Own Path. We're a nonprofit mental health organization in Ohio that provides inclusive, holistic, trauma-informed care. So we offer mental health care, mental health therapy. We have EMDR, embodied therapy, EMDR, I already said, art therapy. And we also offer yoga, Reiki, wellness workshops, professional development, all sorts of really big things. So check out the page. Our link tree has all of our links for you. And I am a late diagnosed ADHD person here. And this is my friend Nick down the street that is a nurse anesthetist, if you missed that.
They could probably diagnose me with it too, honestly.
Yeah.
Like, I haven't let them, but they probably could.
So, I guess we'll start with kind of some tips for people. Like, I know the internet and TikTok specifically is kind of the reason that I got diagnosed or like saw it, even thinking about it. I am a clinical social worker. I provide mental health therapy, and yet never in my like 30 some years at that point did I ever consider ADHD was a root of anything. It was always like, oh, you have depression, or, and then I ended up getting fibromyalgia, and then the depression kind of got worse because of the pain, but never did in my life I think that I had ADHD, because ADHD to me was what it typically has been presented, which is hyperactive little boy that can't sit down in a classroom. And then I started to see all these mental health professionals, licensed professionals, psychologists, counselors, social workers on TikTok sharing, you might have ADHD if, which, take with a grain of salt and do all your vetting. But being in the profession I'm in, I was like, oh, wow, yes. Okay, well, that's something I need to look into. So So
at first you were almost like, oh, this is like, oh, I'm a Virgo and these all match, the way that you can have these TikTok diagnoses because one or two things work. But then slowly you're like, oh, wait, all of these fit me.
Yeah, especially when I learned the differences between like how it's expressed gender-wise, really because of how different genders are socialized. So for little girls and women and AFAB people, it's very much an internal experience oftentimes. And it's we're socialized to like sit down and be quiet and have manners and be polite and not be too loud and not be disruptive, right? So all the things, like if I think back, it was like I had so much little evidence. It was like I was super bored in class, but I knew I couldn't, like, I would always get in trouble for talking too much or passing notes. So eventually I just started like writing notes like I would just write letters and write notes to my mom like every day because I was so bored. I had all my work done ahead of time. Like I'd be the person that finished the test first, and then I looked around and I was like, okay, well I can't be first. Like they're gonna like think I cheated or something, right? Like so I was always bored, and I was always fidgety, and I was always asking to get up to go to the bathroom because I just couldn't sit still. But I knew I didn't want to get in trouble by doing something. Versus how boys are socialized. So like looking back at all of that, it was
right. For boys, it's kind of simple. Like what, your son won't get D's and F's, and won't, if we can just get him so he won't be running around the classroom. So it's a bit more cut and dry. Like give him Ritalin or have him have bad grades. Which one do you want?
Yeah.
And you're saying for girls, it's a bit more complex than that.
Yeah. So then I think that kind of leads into like impacts of not being diagnosed. If you aren't. Or I guess maybe I should talk more about like how I went through the process. If you're wanting to get diagnosed, you're going to want to find a neuropsychologist. Sometimes psychologists can be trained with the additional, screenings and diagnostics that are needed. But this isn't something typically that like master's level or even definitely not below folks are really doing. I know different states have different protocols and specializations, but typically it's something that you're going to at least want a psychologist to evaluate.
Sure. Like at Ascend, at my center, what we'll do is we have a psychologist, Dr. Langer, and he's a bit old school, so a lot of times he'll do some tests, but a lot of it's just talking to people. And so sometimes he'll say, you know what, they do have ADHD. Why don't we send them to our psychiatrist or a nurse practitioner? And then that nurse practitioner or psychiatrist will say, yeah, we really need to medicate you. Or I agree with his assessment, but I don't feel that medications are right. So it can be challenging because he's so busy. A lot of times patients can't make that appointment or no-show. Then we tell them you can't reschedule with them. But then, well, if they miss their appointment, they probably do have the ADHD. So there's this great irony with everything related to this.
Keeping appointments. Yeah, I think the ableism and like the lack of accommodations and accessibility can be quite a challenge.
Right, and if you made your appointment and you filled out all your paperwork and you did it right, well, you're adjusting to it just fine. So maybe we don't need to put you on meds. So every situation has to be kind of looked at individually.
Yeah.
Like, what are we really trying to do here? How can we do it? So
I remember I showed up to my assessment like with everything prepared. I went to my childhood home. My mom kept like everything, which was helpful in this situation. So I like sorted through and found report cards that said Amanda talks too much or whatever, right? All very justice focused. Like I've always been that way. And now, obviously I'm a social worker, but it was just like, there was little bits and pieces of things. And I was like, this is evidence. And then I was like, wait a minute. I'm too prepared. Like, they're not going to believe that I have ADHD because of all the executive function that it took to do this. Right. So I had to say, like, look, I've seen people that have, like, gotten denied or whatever because they weren't prepared. And I need you to know how hard it was for me to do all of this. But I did it because it was very important. Yeah. Definitely seek out testing. And then depending on your situation, for me, I have a very good relationship and long relationship with my PCP, who's a DO, and I kind of just let him know, like, I got an assessment, they sent the records over, I'm not sure if you saw that, but they're recommending medications and I wanted to talk to you about that, and he was willing to do that. Right. Sometimes you need to go to a psychiatrist or other specialized provider. Right,
and for us, like I said, it is more of like more than just one approach, but the thing you don't want to do is just go to some random person and they'll say, yep, you got it, here's your meds. It's not as bad now, but during COVID we saw that there are a lot of industries that started I call it Facebook ADHD, and I think I even did a video about it where it's like, well, this person doesn't really know you. their whole business model is saying, yes, you do have ADHD, here's your stimulants. Now, that doesn't really work. I mean, that's for everything in healthcare. Like, I know you talk about trans issues, like everything in healthcare, none of it works when just some guy who's supposed to like rubber stamp this thing for you says, yeah, oh, for sure, that's what you have. So it is someone who you have a relationship with, that, and it may be more than just one visit, that slowly you can see, okay, you have the thing, and then the next important thing is, oh, what do we do about it? Which in some cases is nothing. Like, okay, now I can understand some of my behaviors. I'll look at some tips like we'll talk about and make a few adjustments, and then I'll be fine. Because I don't think you want to just go into this saying like, yep, I've got a thing, where's a med for the thing so I can move on with my life. That's not really what we're talking about here.
Yeah. And I think a lot of times people go undiagnosed or underdiagnosed because of things like I shared, but also when I was in the substance use treatment realm, we ended up seeing a lot of people that were using methamphetamine. I don't know if I can say that on TikTok, probably not.
We'll go back to our community,
or
community TV show.
But like using that, and they were like, I don't get a euphoria. It doesn't make me feel, I can function. I can focus. And then we ended up getting them, clean sober for a certain amount of time to be able to get through post-acute withdrawal and have real assessment of their symptoms and their history. And lo and behold, undiagnosed ADHD found something that was like, oh, that helps, right? And so like in those moments, it's like, they've been shamed for so long. Oftentimes, maybe they've had criminal justice issues, like maybe they've had relationship issues, financial issues, because executive dysfunction causes a lot of that. Emotional dysregulation, really heightened emotional states can cause relationship issues. So oftentimes people get put into other treatments or sectors, right? They end up in criminal justice, or they end up in...
And the ethics are confusing.
Antidepressants.
Well, the only difference is I don't have a copay, and this person who gives it to me like wears a hat backwards, and it's not a doctor's office. Like it gets really confusing sometimes.
Yeah.
And of course we can justify ourselves into anything as well. I mean, that's one of the things I want to talk about, that there's plenty of meds that will help you function better, but because of the side effects, like you have to make these moral choices of like, to what extent am I willing to get better? Like how much of my brain chemistry changing am I okay with? And honestly, those are issues to talk to with a provider who knows you.
Yeah, absolutely.
So, and I might as well just finish that random line of thought, because we know steroids in medicine and in anesthesia are something where it'll cover up things for a little bit, but eventually it'll harm you. The most obvious case is opioids, but there's stimulants fit in that category too of long-term there's effects, short-term. It's very rare that we'll put someone on stimulants and then they'll be like, nope, this was dumb, not interested. It's like, even if they shouldn't have gotten them, it's always like, oh, I can do so much better. It's like, well, of course you can. We just turned up all the dopamine in your brain. So it's always a question of like, okay, once I get on this medicine or once I do this, like, what's my end game? And in the case of stimulants, a lot of times it's hard to get them. Every month we have someone calling the office saying the pharmacy's out, where do I get them? And it's a treasure hunt of hoping you don't run out of them before you can find them again. So,
absolutely.
And it's not saying that you shouldn't do it. It's just that it's not as simple as like what the pharmaceutical companies make it sound like, oh, you're deficient of something, let's get you some store-bought and then everything will be fine. So
yeah, there's a lot of things to rule out too. So like specifically complex trauma, any neurodevelopment issues, autism, even though a lot of times autism and ADHD co-occur. There's a lot of substance, like there's a lot of things that need to be weeded through.
And I'm all about the like, let's get you better so you can actually make these decisions. Because I mean, that's what we do at my clinic with ketamine. I don't want to be hypocritical where I'm saying, oh, stimulants bad, ketamine good or something.
Right.
But it is that same idea of like, okay, once you're performing well, then you're like, okay, do I need to stay here? How do I stay here? And most importantly, how do I stay at this high function without having to, come in every 2 weeks for this medicine or whatnot? And sometimes when you're in survival mode, you don't really have the option. Like we'll give you some tips, but at the same time, a lot of times you have to be at a certain level of functioning before you can integrate something by yourself.
Absolutely. Yeah. And then I think as far as like coping, like if you don't have access, I always think about accessibility, and privilege. So like if you don't have accessibility to get a full diagnostic assessment, like it's going to be a controversial thing to say out loud, but like I feel most situations, self-diagnosis in those cases is valid if you've like done all of the research, all of the vetting, all the things you can possibly do. And the point of that for yourself is to make accommodations that make your life easier, right? So like, that's what I tell a lot of my clients is like, make the accommodations that you need. Obviously not like harming yourself or anyone else, but like if that helps you navigate life better, addressing that, then go for it.
Yeah, absolutely.
Mindfulness and meditation is highly recommended for ADHD, obviously, to help you be in the present moment, help strengthen that frontal lobe and focus and concentration. And then I know our friend Brittany at Alternative Therapeutics does neurofeedback, and that is also one of the helpful recommendations.
Sure. And a lot of these too, I get questions like, well, how do I do that? Well, I'm a terrible handyman, so whenever I try to fix something at my house, I like go look up a YouTube, and you can do that. Like, how do I do biofeedback? How do I do this? How do I practice that? And because we already know if I'm like, okay, so you need to read 400 pages, again, your book is very skinny, like you'll be fine. You're going to do great with it. But it's not something where you need to like use every bit of concentration you have for the day. You can just watch a video and then glean from it what's useful. Because obviously there's also a lot of terrible YouTubes out there that will not help you at all.
Yeah.
But even that process of weaning down into, okay, this is what's helpful for me is really therapeutic.
Yep.
For sure. For one example I can think of, for me, I would set a timer, and you can't use your phone because that's cheating, because then you're going to be like, oh, let me check my notifications while I'm doing this. But setting a timer of like, for me, it was like 20 minutes of prayer when I was going through a hard time. That otherwise I'll just perseverate and think about this thing and not get anywhere and think I did something. Instead, I'm going to like concentrate on this, spend some time, do nothing else. And that was really hard, but like at our clinic, we'll do Spravato, which is like a ketamine nasal spray, and the patient has to sit there for 2 hours. And for half of them, the actual action of carving out 2 hours of their day that isn't just kind of spent doom scrolling and being somewhere else, that forces you to kind of concentrate on yourself and what can I do for myself.
Yeah.
Without just getting to like some sort of self-pity cycle, it's really helpful. So even if you have to start with 5 minutes, 10 minutes, just taking time out of your day to be sort of like your time away from yourself or your time away from just the unconscious things you're doing every day really helps to develop that mindfulness.
Be off, like turn off, literally, like, but also be on to be present with yourself. And I think for a lot of people, especially if you've gone undiagnosed or you're struggling with mental health symptoms, or you've had trauma, it's hard to exist in that discomfort of being fully present in your body. So even just getting comfortable with that. This book actually was recommended by a friend that I met on TikTok, and who was on our podcast a couple times, Dr. Leslie. She is a PsyD, and this is one of the books that she recommended on one of her lives. And I know it's backwards, I'm so sorry. But we were talking about
your first practice.
Women specifically. It's called A Radical Guide for Women with ADHD. And there's a few different books. I think it's Solden. There was a few different books that Leslie had recommended by Sari's. And I've done this one myself, so I definitely recommend.
Awesome.
If anyone has any questions about ADHD or comments, we're happy to take them. Otherwise,
I did think what might help too is to like, you don't have to go straight through the DSM-5, but defining it, because it is a bit of a TikTok diagnosis, no offense meant to the TikTok community, of like, what? I can't concentrate, and all of us are on our phones, so all of us have some of the symptoms of it for sure. And that is sometimes one of the tips is like, okay, well, avoid the things in your life that are so immediately like a dopamine firework in your brain, so that, because for example, my stepkids, when they're watching like an action movie, there'll be like a 1 minute of like soft dialogue, like the only minute in the whole movie, and everything else is explosions, and they'll start bothering each other because the stimulation.
Because there's downtime. Yeah.
And I usually tell them like, okay, so the key to being successful in life for your generation is be able to be bored, because if you're able to be bored and no one else can, then you're gonna get much farther than anyone else in your generation.
My 3-year-old already says, "Oh, I'm so bored." And I'm like, "Oh man, we got so long to go."
Yeah, and it's so great to be bored. Like we figured out all your yoga blocks and had a great time like making some sort of Lego thing for all these cameras to work. Although that one does look a little crooked.
It's a little wonky. It's fine.
Yeah, that's totally my
It's okay.
work.
This is just our head, so we're good.
It's fine.
We got the best view on TikTok, I think.
For sure. Yeah, best was for TikTok.
Just see, I think this is just people joining. Okay. Yep, just people joining.
So what what really, and you already mentioned that it is different in women, that it's not as much the outward activity, but it's more of what's happening inward.
Yeah.
So what are some signs that, and again, this isn't meant to be diagnostic or a substitute for seeing either of us in the office or whatnot.
Yeah. So it's like really difficulty concentrating on things, feeling restless, but then again, like so many of these things have to like overlap. So like that could also be anxiety, or that could be a physical health issue, or that,
Sure.
or a trauma response. So, difficulty concentrating, difficulty staying on task, starting projects and not finishing them. Oh my gosh, I don't have like I said, I don't have the diagnostic criteria in front of my face, but there's something about like difficulty with heightened emotions or like change.
Sure.
Yeah.
Which, like you said, sounds a little bit like autism of I'm in my groove right now, how dare you take me out of it or whatnot.
Yeah.
So asking for a friend, of course, not for me. I would never do that. But what if you like being that way?
Embrace it. I like being neurospicy. So.
Well, maybe it's more of a see how like the world around you is reacting to it. I don't mean like people that you meet in the grocery store, but is it difficult for your family? So one example I've said often is there was a woman who came in for ketamine infusions, and she did great with them, like having a blast. But it actually made it more difficult for her family because now she had more energy to have all these terrible behaviors. So I was like, okay, stop. First of all, your grandma can't pay for this anymore. You have to. Like, we need your own investment. And secondly, like, we're treating systems here. Like, your practice is the same way, where we're not just finding someone in isolation and like, let's mold you into like the best person ever. It's more like, no, we're treating an entire system. It's not, my wife did this, and so because of that, I did this. It's like, I did this, and my sister did that, and the dog did that, or whatever.
Yeah.
So that's one way to think of it. It's like, if you're having a great time, but no one else is, eventually that's gonna come crashing down on you.
Yeah, and that would be for any other mental health condition for sure, or behavior even. And so part of the assessment process too was like my mom came in actually for an interview and filled out a paper, and then my husband actually filled out a paper. Now when you're a child, it's like the teacher and I think the pediatrician, and those, I hope that they change that process soon, because like you said, it's like more about how the symptoms are impacting everybody else, and I don't feel like a lot of the assessment process is like how you feel about yourself or how you're like the internal struggle of the person. It's more of like how the behaviors outwardly affect other people negatively. So I wish we had more of like a strengths-based way of assessing, if that makes sense.
Right. Well, could it also be like, how good are you at entertaining yourself? Because some of it is almost like boredom with the self. Like you mentioned a big part of it, which is being uncomfortable with yourself, almost as if you're a stranger and you do your like tight-lipped smile and you don't know where to go from there. But it might be also that, and some of this could be a self-esteem issue, but you're not interested in yourself and there's no desire to get to know yourself, if that makes sense. Like, I've had some times alone and I'm like, oh, I really enjoy being with myself. I mean, that part of that might be communing with nature. Like, it's easier to be comfortable in your own skin if you're seeing something neat, like a wooded path or the sunset or something like that. It's almost like creating experiences. It's sort of self-love, I guess, but creating experiences just to share with you, not for TikTok, not for Facebook, not to like tell your friends later on, just for yourself.
Yeah.
And being more comfortable in your own skin, there's less of a chance of like, okay, I really need some stimulation here.
Yeah, and nature is my jam. Being out in nature is a mindful skill. It's grounding. It could be spiritual. So it's environmental. Like I always talk about the 8 dimensions of wellness, and like going out, just walking on a nature trail is like at least 5 dimensions, because you're walking physically, you're getting environmental wellness, you're getting the social wellness if you're passing people on the path and talking to that. Like, there's so many ways.
Because we work a little bit with memory at Ascend, and there's studies that show that, okay, so if you're an older person and you're just walking for your exercise, it'll be good for you physically, but doesn't really help you mentally. But if you take that same 2-mile walk, let's say, and instead you're hiking, it actually has all these cognitive benefits. I mean, it is just things like your brain saying, watch out, that's a root, don't trip. But for whatever reason, just that extra layer of walking through the woods is extremely beneficial for your brain. So, and it is a way to keep your brain engaged. So that's some of what we're talking about with dopamine, with ADHD, is find ways that your brain can be completely engaged. Not like watching a TV show and flipping through TikTok and half watching what we're doing on Facebook as well.
Yeah.
But like, what are some activities that are entirely engaging in a good way?
Yeah. Thank you for liking and sharing, Ansley. Hi, friend. So I also think, I got distracted by looking at Ansley. What did you just say? It got me.
No, you're doing great. I was starting to say about being fully engaged. And you just gave an example of what happens when we try to do three things at once. I was going to say video games, which are
yes, thank you. There it is. So I hear oftentimes, especially with parents of like younger kids or even like the transition age, they're like, all they want to do is play video games, or all they want to do is do this with their friends, or they only care about this thing on their phone. So how do you balance that, right? Like, where the things that do give you dopamine, you can't, right? Like, we have to participate in capitalism, so like we need to be able to take care of ourselves and function in society, unfortunately.
Right.
So how do we balance that out of like, oh yeah, it's okay, find things that you enjoy and give you the dopamine, but also we need to do these things.
And I think it's actually in play. So I think it's actually healthy for little kids to be really engaged in a video game and then be able to turn it off and go do something. So if you watch little kids playing, it's both the lamest thing you've seen and the most exciting. There's like 3 minutes of just waiting to get on the slide. There's like an extraordinary experience on the monkey bars or going down the slide, but it's completely sympathetic, then parasympathetic, then sympathetic. It's exciting, then it's stupid, then it's boring, then it's exciting, then there's almost a fight. So, and even as adults, like getting into those type of experiences where you have to quickly switch from your parasympathetic to your sympathetic nervous system, and there's really nothing crucial, like you're just doing it. It's called play. So
yeah.
I mean, it's easier for me because I'm an immature adult at 42, so it's every day who I am as a person. But trying to get back into, okay, as a kid I was able to switch quickly between this fight or flight or the rest and relax, and it wasn't that big of a deal. And as adults we just get like stuck in these positions where we just demand comfort, for example, or we demand stimulation. So I think that's a good tip too of practicing, like see how kids play, see how you can do that responsibly as an adult. Or irresponsibly. I built 2 snowmen 2 days ago. It was a great time.
And that goes, like, in our practice, we are all about healing the inner child, too. So
Yeah.
I do a lot of inner child work, and I'm often asking my clients, like, okay, can you go play today? Like, when's the last time you played?
Yeah, skill building, just like as you would when you're doing therapy for kids.
Yep.
And that is kind of our main theme today. Like, if you get to like yourself, you're not going to have to like go to such great lengths to keep yourself happy, because it's really tiring to keep yourself jazzed all the time, and it's super expensive too, because you said we're in a consumer culture where like everything is like, can you please give me your money so you'll be happy.
And oftentimes, like, the accommodations that people with ADHD might need to stay focused, like, for example, if you need help organizing your task, like, you need to buy some kind of digital planning system or, you know.
And is there a good way to ask those accommodations? So I went to Cedar Point a few months ago, and I was really butthurt by the amount of people who had like little notes in the doctor and got to go to the ride in front of me, because I'm like, mental health is a stigma. But that doesn't mean I want you to get in front of me in line. I'm sorry. Maybe it's somewhere off my heart or whatever. But there are certainly ways that you should try to figure out, how can I be accommodated, and how can I present that in a way that it doesn't perpetuate this, like, oh, someone's trying to get like ahead of me in line.
Yeah.
Are you talking about like the extra 10 minutes for the test, or?
Yeah, I mean, it depends. I mean, if someone needs and is deserving of and they offer it at Cedar Point, then go for it. Like, because you don't know who, like, how standing in that line is going to dysregulate someone or activate maybe OCD, like intrusive thought. Like, we don't know what's going on. So yeah, whatever accommodations they need. But I do it oftentimes because I have a lot of like the transition age people.
Sure.
And so they're like trying to figure out college, and I'm like, all right, let's talk to your university how you can get disability accommodations, or at work, in the workplace, what accommodations can you get? So often helping them come up with examples. I'm a major fan of, I'm not yet sponsored by, but would love to be. I'm a big fan of the Loop earplugs. Those are amazing to me. Like when we go to concerts and it's just like too loud that it's like dysregulating, but I still want to hear it. I put those in. Or if I'm at the grocery store and just the lights and the sound is too much, I put them in. Sometimes I hop on TikTok and listen to a live or listen to an audiobook, or like lighting, like those lights, can't stand them, but like ability to dim the lights, or more time on a test, or being able to come in a little bit later to work.
So I think what you're saying is, you can start doing self-accommodating, figuring out what you need, and then you'll be more targeted, saying, hey, professor, here's the one thing that will help me.
Yes.
And by doing that at the beginning of the semester, not after you've missed the midterm, it actually will allow you to, again, not have a leg up, so to speak, but you'll be able to know yourself and know what helps you, and you can ask for that with more boldness, because okay, I've tried a few things, this didn't help, this does help, can you do that for me?
To advocate for yourself. Yeah.
And if they don't, you can just move on and do what you can, because that's a challenge with ADHD, because it can be so interwoven with some of these other diagnoses. It is easy to ruminate or to really feel the pain of like, I was rejected at this. So but that goes with play. Like, you fall off the slide. This is a terrible example, but like my nephew's 1 year old. I'm like, yeah, you're old enough for this slide. We've got this. And there's studies where it says young boys aren't breaking their bones like they used to. And it's actually a bad thing. It means that they're actually not trying to see what the limits are. I mean, it's good for the bones.
They're not being brave.
Right. But for their mental health and for like the longevity of our species, it's not a good thing. Of like, you actually do need to.
They're not trying new things. They're more hesitant.
Yeah, it's that whole thing where like helicopter parents everywhere except for what the kids see digitally. So it gets into this ironic thing that's a complete tangent from what we're trying to talk about. And that is another tip. So things like this, Amanda and I are friends. Yeah, we can go on tangents even though we're trying to focus on the internet to provide you all with good content. It's fine. There's other scenarios, like maybe I'm talking to a nervous patient and I don't want to make it about my random tangent. I want to make sure to focus on them and talk about the subject at hand. So
back to accommodation.
Right.
But that also goes into like diagnosis, right? So I'm always preaching like, you don't need a diagnosis to get care.
Absolutely.
Like, you don't need to be pathologized because it's of your inability to participate in our unhealthy societal structure. Like,
right. If you need Zoloft to do your job, maybe get a new job. That's a better option than coming to a Ascend Health Center to get your Zoloft. Free tip. All right, continue. There's
things that are just more accessible when you get a diagnosis. For example, ADHD is under the ADA as a disability, so it requires your school, workplace to give you accommodations. So that's kind of like the catch-22 of like, do I want to get diagnosed? Do I not want to? Do I think that'll be more of a benefit to me?
And I think it does take some healthy self-image, some healthy self-reflection of like, how can I not abuse this, but also get the accommodations that will help me to be a better employer, to be a better student, that sort of thing for sure. Because we got a letter just last week asking for accommodation. We're like, nope, this is just somebody trying to get out of work. We're not signing this. And so, you do what you can. And again, you have a good relationship with your provider and you kind of go from there. So
a lot of times it's my people getting like for school, it might be getting something in like a different format, maybe like getting the audio book version of it as well.
And what you said about pathologizing it. So let's say you go for testing and they say, nope, you don't have it. And you think, well, but I think I have it. And I feel like I have a lot of these symptoms. Again, everything in your mind is on a spectrum. So you don't need an official diagnosis. It doesn't mean you should go around telling people this is exactly what I have, but you should still, all of us in this world where we have computers in our hands every moment, need to do these tips and need to work so that we can be better people, that we can be more engaged, more present. Otherwise, like, what do we have to show for ourselves is, well, I think in 2024, I don't know, I liked a couple of TikToks, saw a couple of reels, Netflixed a lot. So regardless of what somebody says you have or don't have, whatever you can do on your own to help yourself, like, go for it.
Yeah, make the accommodations, get the resources. I know it's silly, but there's one called ADD Attitude. As a resource online, it's like Attitude Magazine, I think, but they do a lot of really good like articles that have guests like experts doing the articles, or they'll do webinars about certain issues like ADHD in children, or they did one about ADHD in women and girls, and they did then they have like articles about like supporting yourself with ADHD in the workplace, giving you tips and tricks. And then the other one is CHADD, CHADD.org. I don't know if you've heard of that one, but that one is also, it's a .org, so it's a little bit more of a legit source. But that one has a lot of really cool, like helpful, again, downloads and resources and tips. So whatever you need to do to accommodate yourself and your needs, for sure. And if you have privilege and access to be able to go get a second opinion, then absolutely do that. Like this is something my mom like instilled in me, and now I preach it too, is like only you know your body. Like,
Right.
nobody knows your body more than you. So if you feel something isn't right, if you don't feel heard, if you are concerned about something within your body, go seek help until you can get that team that you need to take care of you.
Absolutely.
And I say team because oftentimes it's like we are walking systems. Like, we have all these different aspects to us, and so many different factors go into our existence and our well-being. So it might, you might need more than therapy and medication. You might also need to like increase your social supports or decrease your tech time, like your time on social media.
Because I always talk about finding the root cause, but last week I was talking to Dr. Angela from Summit Natural Wellness in the Valley, and she was like, well, another way to think of it is, instead of like, well, is the root cause of everything my ADHD, my depression, my pain, or whatever, but another thing is like, well, what's most limiting? Of everything that's going right or wrong, like what is the most limiting? And maybe it's just a random symptom, but so I have a background in functional medicine where it's always about you got to get to the root of it. But sometimes like, well, look, I know this is a random symptom of something, but this is what's bothering me.
This is the most important
this is what
thing
we're gonna tackle
right now. Yeah.
And there's a lot of freedom in deciding like, here's my priority for my health. And I wouldn't say it's a luxury, but it is nice to get healthy enough to be like, okay, this is what we can focus on, instead of coming to a doctor or to a therapist in complete survival mode where it's hard to even tell where to start.
Yeah. And that's like the autonomy and self-determination piece too for me, is like, yeah, I want to get to the root cause too, but like, if right now your only priority is being able to like get out of bed and get to work, okay. Or like you want to have better relationship dynamics with your partner, okay. I might still be looking through this lens of like, the reason that you're having the communication issues with your partner is how you didn't have healthy attachment. But like all of those things, I'm going to see it through that lens. But if you're not ready to go there, then I'm just wasting my time.
Because I think that's kind of what I said earlier, that a lot of this stuff you kind of need to be in a better state, and then you can make those rational decisions of like, you know what, I'm fine for now. And even economic decisions. I talk about this a lot, and it's kind of embarrassing. But I feel that healthcare sometimes is an economic thing where we decide, you know what, I want to get this much better, it's worth this much to me.
Yeah.
Maybe it's just because I go to restaurants, I'm like, well, are the cheese sticks worth $9.99? And so I'm not saying that everyone should make decisions that way, but it's also nice for us not to have to make emotional decisions, because what does ADHD affect? Our emotions. So it's good to have a couple different ways to determine these emotions, not just on whatever your serotonin or dopamine tends to be doing in your brain that day.
Yeah. And speaking of finances, that's an area that often like symptom wise, and a lot of times people with ADHD have issues with spending and overspending and impulsive spending, because again, the impulsivity piece of that.
Yeah.
Having a hard time keeping up with payments on time, getting a ton of late fees on things. Yeah.
And that goes back into the tips, like have things auto deducted from your checking account if there's enough money in there. Just because I had a credit card for 10 years that every month I'd get the email and then I'd go and pay it. And it took me that long to be like, you know what, I don't mind doing this, but there's a little part of my brain that's like the pay your city card part of my brain that could be doing something else.
Create systems and processes and accommodations. Absolutely. Yeah. And sometimes you need to ask for support to even set up the system,
this
because
is hard
that's
for me.
hard.
I don't like systems.
Can you just body double with me while I sit over here in the corner and make my Excel spreadsheet? Okay, thank you, right? Like it might even just be that. I have friends that once a week, me and my friend Molly, on Tuesdays, 10 a.m. to 11 a.m., we body double. She's all the way in Minnesota, and we get on Zoom for an hour, and I'm like, all right, what are you going to work on? What are you going to work on? We put it in the chat for accountability, and then we just mute and start going, and every so often we'll pop back in and say, hey, can I just talk this out with you, or do you mind looking at my thing, or whatever it is.
That's a great idea.
Like whatever, like I said, whatever you need to do to make you comfortable, within reason, right? Like not within reason of not making other people uncomfortable. But I think that about wraps up our conversation about ADHD. I appreciate you coming down here, Nick. Did you want to just close out and let people know where to find you? And
Oh, sure. We're right up the road. So we're both in the Fair Lawn, Copley area. We do some virtual visits too, but it's better to have the first one in person. AscentHealthCenter.com. And we work with Amanda and a lot of other providers around the area. So, and that's important too, is what we're saying, is to find that team, because it might not be me, might not be her, and that's perfectly fine. Just finding someone who you're comfortable with not necessarily who agrees with you, and you do want someone who will challenge you, meaning that, it's healthcare isn't something where you just find something on the internet and all right, full steam ahead. It is something that fluctuates and changes, and just find someone who's willing to change with you and help you meet the goals that you have so that you can live a better life.
Yeah, absolutely. And again, I'm Amanda Costura with Carve Your Own Path. You can go to our link tree or cyopinc.org to get more information. Thank you all. Take care.
Now we have the Arduino.